My name is Mark Carey. I'm one of the senior scientists at the Ottawa Hospital Research Institute at the University of Ottawa in Canada. And I'm also the chair for the Hemostasis and Malignancies Subcommittee of the International Society of Thrombosis Hemostasis. Committee on hemostasis and malignancy is really important because thromboembolism is the second leading cause of death in cancer patients, and therefore at the committee we like to identify what are the current problems, what are the knowledge gaps, what can we do. Sometimes it's a matter of standardizing certain assays or certain experiments. Sometimes it's about standardizing different definition for clinical studies. And often we invite our young investigator to present their research ideas, see if we can find collaboration within the community, see if they can have additional sites. We invite them to present a pilot or a draft of their study so people with experience can look at it and provide some constructive feedback. And often we like to have them coming back and say how they're progressing over time. And then once the study is published, that's when meetings like ICTHIC are very important, because it's one thing to do this study, but it's also very important to disseminate the knowledge. Not only us researchers or specialists in thrombosis and cancer, but also that oncologists, hematologists, general internists know what the results are so that they can use it, incorporate it, change their clinical practice. So really ICTHIC is providing a pivotal role in that, to provide knowledge dissemination throughout the community.
What is your current field of interest? Are you conducting any study at the moment? What are you working on?
Right, so I'm a clinical researcher, so I do a lot of clinical studies, and right now we have a couple of studies that are related to cancer and thrombosis. One is we're trying to prevent venous thrombosis from happening in cancer patients, so we're using a new direct oral anticoagulant to see if it has an effect to prevent venous thrombosis complication in cancer patients undergoing chemotherapy. That trial is called the AVERT trial, and it's ongoing. And then a second trial that we have is we look at low-molecular heparin, and we would like to think that low-molecular heparin can decrease the metastatic spread of cancer cells, and therefore we have a study where patients with colorectal resectable tumors are randomized, or they have 50-50 chance of getting low-molecular heparin, tinzaparin, or observation, and then we follow them over 5 years, and then we hope that will decrease the disease-free survival in these patients. So one trial to prevent blood clots with a blood thinner, and another trial to use a blood thinner but to have an anti-cancer effect on it. So we're hopeful to have these trials done within the next couple of years.
Okay, they're in phase 2 now?
So they're both phase 3 studies, but the recruitment is ongoing. So hopefully we'll have all the patients we need by the next 18 months.
How many hospitals or countries do you have in the moment?
Right, so for the AVERT trial, currently it's only in Canada, but we're opening sites in the Netherlands in the near future. So we'll have about 20 sites recruiting patients. For the peri-op trial, the trial looking at tinzaparin for disease-free survival, we currently have 21 sites, and we're opening sites in Belgium as well. So it's going well.
So you're encouraging people to...
Absolutely. It's a broad field of research, very many unanswered questions. It's a very collegial group, a very friendly environment. So for young investigators, if there's an interest, there's opportunities to be well mentored, to establish collaboration and do their own studies, no doubt.
Are these studies about all types of cancer, or they are specific areas?
Right, so it depends on the type of study and what you want. So for the AVERT trial, it's all type of cancers, but we try to stratify them to see if they have a higher risk of having a blood clot. So we don't want to give blood thinners to all cancer patients. We want to give blood thinners to cancer patients that are at high risk. And we use a risk stratification model called the Corona risk score in order to stratify patients. So these are all tumor types. But as you mentioned, some tumor types are more likely to have clots, and then they would have a higher score just based on the tumor type. For the peri-op trial, the one looking at tinzaparin versus observation, this is specifically for colorectal tumors.
What do you think about real world studies versus trials?
Right. So I think they're both important. They provide different information. So I think the trial is good to establish an effect, to make sure that in a very strict population we can be confident that, for example, a blood thinner decreases the risk of having blood clot in the future. And then once we prove that, then the phase 4, the real world data, is also very important, because in real life, not all your patients will fit your inclusion-exclusion criteria. They often have a lot of comorbidities that might lead to other complications. So I think real-world data, phase 4 data, is really important in the future to make sure that the findings are not only for these specific patients, but generalizable to the entire patient population.
At the moment, the ADVERT study is for people until up to what age? For instance?
There's no age
No
cutoff.
age. Okay.
No.
So that's good.
Yeah, but we need to make sure they're not at high risk of bleeding or having complication, but we don't restrict patients based on their age.